So for my final year, I chose to do a placement. And the one that I got assigned to was Buzz Health Manchester, which is a GP and exercise referral scheme that's run by the NHS. The two different kind of sides to the role was consulting, which obviously took place in the GP centres. This kind of was introducing patients to the scheme that had been referred here by their GPs for it can be a multitude of different conditions that they could further manage with exercise. There was a PARS class, which is like a generic class, so this generally applied to people that had like back and neck pain, people that had been in car crashes, that had whiplash and motorcycle accidents, things like that. It was kind of a broad spectrum of people in there. There was also a COPD class, which is obviously tailored specifically to the respiratory disease, and just further helping people developing what they needed to help with the progressive disease. So during my time on this placement, I would be shadowing the people that I was with, so it changed from time to time, but it was mainly just two people. And I would learn more about the role there and what I would be doing if I was in that job, and they kind of treated me as if I was working there, which was really useful in terms of me deciding if it's something that I wanted to do or not. I would say that it's also something that is good because you can put it on your CV and it's industry experience for you, and obviously it helps you decide as well if this is something that you want to go into or not.
During my time at placement, the structure of the sessions stayed pretty much the same each week, but the individuals I worked with varied drastically, as you've got obviously patients with different abilities, different heart problems, different ages, so when exercising them they're all going to have a different level that they can exercise to. Some individuals you'll find don't need your help and can get on with the programme on their own. Others you'll find will need obviously constant one-by-one help depending on their ability. For one patient in particular, I was able to give my input on resistance training. They have quite a serious heart condition, so I was working on a one-to-one basis, but resistance training isn't widely used at the moment in cardiac rehab. For me, coming from a nutrition and exercise and medicine background, it was nice to give my side of things input into the session in a different way, different knowledge and different approach, which made me feel happy that I had accomplished something. So overall, a positive experience on placement, and I definitely left there with a lot more skills and abilities and clearer insight onto what happens in cardiac rehab and how to train individuals with heart problems than when I arrived. So give placement a go, don't be too afraid, and I'm sure you'll enjoy it.